I think the other big challenge, like everybody, is workforce, and in common with everyone else in the NHS at the moment, trying to get enough capacity and resource to deal with the support that we need and to get the workforce in that we need is a big pressure for us. And I think, you know, we are working closely with our colleagues in other health boards to think about novel ways of sort of bringing in new workforce. But I suppose the other big challenge facing everybody is the financial resources. You know, everybody's strapped for cash at the moment, aren't they? And therefore that brings a challenge. But I think it also underpins why the current model of care is probably not fit for purpose, and we need to start to think about a more longer term financial plan that is about how do we tackle some of the long term determinants of health, because ultimately at the moment we're pouring more and more money into the most expensive bit of the system, i.e. the hospital sector, when actually really what we need to be trying to do is think about how do we move more money upstream into prevention and public health interventions that will start to help deal with some of the burden of disease pressures. So yeah, I mean, the challenges are similar. There are some particularly acute challenges in my part of Wales because of the demography of the population. But I think, to be honest, it's just the level of degrees of severity of the pressures that the rest of the NHS is facing as well.